Good afternoon. Good afternoon, everyone, and welcome to our webinar. It is so disappointing that we are not all together in Montreal, sharing time together and hopefully being inspired by the guests today. But I hope that you will gain so much information after hearing from experts today, and of course, intended parents who are in Canada from France and had a sweet, sweet baby girl that you will meet shortly yesterday. So today's webinar is really an opportunity for providers to share knowledge and information to ensure that as you embark on your journey, you are able to do so confidently with knowledge and understanding, and you're able to ask any provider that you meet with some key questions to really ensure that they are looking out for not only your best interest, but the best interest of any children that are born through surrogacy. We often race to the baby, and while it's beautiful and wonderful to start beginning to dream about parenthood or adding to your family, we want to ensure that in each and every step of the way, it is handled in such a way that honors you, that honors your surrogate, and as well honors your children. And so today we will be hearing from some amazing people. We'll be hearing from Rachel West, an amazing, amazing lawyer. She's located in Calgary. She is French speaking and works with many of our clients who have surrogates in Quebec, and will provide a general overview of surrogacy in Canada, as I know there are some of you on this webinar who live in Quebec, however, may have interest and want information about surrogates living outside of Quebec. Her presentation will be in French. Then you will hear from Doreen Brown, who is an amazing, amazing lawyer in Montreal, and she will share with you information on the cases she's won, the laws that she is always working on and championing for the surrogacy community in Quebec. It has been amazing to work with her over the past, I want to say 10 years. She is just fantastic, and I believe her presentation will be in French or English. She speaks both. And then we'll hear from Dr. Lebrak. I must say, I reached out to many clinics in Quebec that we work with, but it really came down to, for me, in terms of inviting guests, having a clinic who has the infrastructure to support your surrogate. And what that means is they have a therapist on staff who is available and in the building should your surrogate need some support, or should you need some support. They have French and English speaking staff, and a proven track record. I have thousands and thousands of clients who have worked with the Create Fertility Center. So Dr. Lebrak will be joining us talking about his amazing partnerships with other Quebec clinics, as well as cutting edge technology that he has been a huge part of championing, PGTA testing of embryos, EmbryoScope, success rates, why twins are not what we think they are. And we will have an opportunity to ask him questions. There's a chat bar to the right of your screen. At any time, feel free to type in your questions, and we'll be answering them after each presenter. Then from there, we're going to have Eric and Jerome join us. They are from, I'm a non-French speaker, so they are from Lyon, France. They had their baby yesterday, sweet Augustine, who we will also meet, and they will share their journey and their experience with traveling across the world to become dads, and how I hope they speak about the intimacy and beauty of the relationship they had with their surrogate, Ashley. We are Canada's only French-speaking, French-staffed, although it's not me, agency in Canada with staff in Quebec. Ashley, who was going to join us, is Eric and Jerome's surrogate who delivered yesterday by C-section. So she likely won't be joining us. However, please know that CFC does have a French-speaking department, and it is so important to me that if you are a French speaker, you have services in your first language. And so as you begin speaking to egg donor agencies, as you begin speaking to surrogacy agencies, it is so important that you have service in your first language. There are so many nuances. There are so many pieces of information that cannot be translated. And there are so many pieces of information that you deserve to have with full knowledge and understanding. And so that would be my first tip as you're looking at a surrogacy and egg donor agency. So welcome, everyone. I am going to speak first for a few moments. I'm going to talk about our egg donor program, Egg Helpers, and our surrogacy agency, Canadian Fertility Consulting. So as an egg donor, as someone who has participated as an egg donor, although nearly 20 years ago, when I started Egg Helpers, it was really important to me that we had a program that really honored our donors. And so when I talk about honoring our donors, I talk about education and empowerment, allowing donors to make decisions around who they donate to, how they donate, the doctors in which they work with, ensuring that if they are interested in a known donation or an anonymous donation, that we support that. It was also important to me that our agency had the same support for intended parents around whether a donor would be known or anonymous. Many fertility clinics in Canada have made the choice to sell eggs. They are eggs that have been retrieved from an egg donor, split into batches of 6, and sold. Well, I believe that there sounds like there are good reasons for that. You're not waiting for a donor or her schedule or the clinic to manipulate your cycle and her cycle, or the surrogate cycle and her cycle. I want to share with you that when you purchase eggs from a batch, you may be achieving a pregnancy alongside 6 or 8 people at the same time. And you may never have access to that donor. And having been a donor, both anonymously and known, I have learned recently that there really is no such thing as anonymity anymore with services like 23andMe and Ancestry. And so we are strongly encouraging all of our intended parents, not necessarily to be known where you know the donor and you're communicating with her through the process, although that's lovely, but having an open ID system so that when you require medical information from your donor, when you are wanting to, in the future, potentially meet your donor or potentially provide that information to your child, it's possible. And so as we educate and empower intended parents and donors, we really want to make sure that fit is right. And so we work diligently to educate and empower people. And many people come back to us and they still say, thank you for the information. We would like to have an anonymous donor. And we absolutely support that as well. We want to ensure that you as intended parents are comfortable and that your egg donor is comfortable with an anonymous egg donation. And the way in which we safeguard medical information, ensure you have the information that you may need going forward, is all information around genetic testing through Invitae or a similar program is placed in your donor agreement. The donor agreement, Rachel and Doreen will likely talk about, in terms of ensuring that you have an agreement that provides, your donor will report future donations. You as intended parents will report birth date and city, just to ensure that your donor's children and your future children, don't have that very, very small potential of meeting or dating or marrying. And so, as I said at the very beginning, it's important that we are looking forward. We're not just looking at getting you pregnant, at getting your surrogate pregnant. We are looking at, your child or children, medical records and information that we know is so vital to their health, and vital to you as parents to know about in terms of your child or children's health. Egg Helpers is run, we're a family business, so it's run by other people in my family, and it's lovely because we work very well together in terms of I run our egg donor program, I run our surrogacy program. Scott and my daughter Christina are leads on our egg donor program, and from our family to yours, we cannot wait to support you in finding an amazing, amazing young woman who is inspired by your story and is eager to help you become a parent or parents or to add to your family. Next, I will talk a little bit about Canadian Fertility Consulting, our surrogacy branch. If you have questions about our egg donor program, please put them in the chat so that I can answer them as well. Okay. Excellent. Okay. So if you have questions, please post them there and I will do my best to answer them. So in terms of steps, often clients come to us at various steps. Some require an egg donor, so we refer them to Egg Helpers. Some have had an egg donor and Egg Helpers refers them to us. And some people come to us having created their own embryos, and those embryos are in a clinic in Canada. They are in a clinic abroad. That piece doesn't matter so much to us. What matters is that we can get your embryos to a clinic that one of our surrogates can attend. And so our surrogates attend clinics across Canada and in the US as well. And we are happy to work with you, with your clinic, to really establish what it is you're looking for in a surrogate. Our wait time is typically 6 months to locate a surrogate and have her medical records reviewed by your physician, and to begin the process of an introduction. We are inspired every day by the amazing women who come to our program and who are interested in supporting people to become parents. They're interested in a partnership. They are interested in moving through this unique and beautiful rite of passage that as women we are able to participate in. And we are so grateful to these women. And we work hard to ensure that there's always a values fit before an introduction. And so one of our team, French-speaking team, if you're a French speaker on this video, they will interview you to find out what you're looking for. And when I talk about what you're looking for, and these are questions to ask yourselves as you begin this process. So you either found a donor, you have embryos, you're creating your own embryos, and now you're ready to find a surrogate. So you've likely spoken to a fertility clinic or you have one already. So here we are. When we're looking at surrogacy, we want to make sure that you and the surrogate, independent of one another speaking, share the same values. So one of the key values we want you to begin to think about is termination. And termination occurs when the baby is unwell, when intended parents have found that there is a medical abnormality detected that is too great for them to imagine caring for the child. And so we ask intended parents to begin thinking about what that would look like. We ask the surrogate, would you be able to terminate a pregnancy should the parents of that child ask you to? And if yes, under what circumstance? And if not, under what circumstance? And so we have you begin to think about that. We also are going to ask you what type of relationship you're looking for with a surrogate. It's really important that that you're very honest with yourself around that. Many people can't imagine what that relationship would be like. And so we are happy to explore that with you. Is it a relationship that is close and connected and you're communicating every day? Is that relationship one in which you communicate by email once a week? Will you attend doctor's appointments? Are you far away? And so this will be a virtual type of relationship. And then, of course, what type of relationship post-birth are you interested in? And we ask the surrogate the same questions so that we can really pair your answers. So when you fill out your paperwork with us, the surrogate fills out her paperwork with us, and we score that to ensure that there is a values fit. It is so important that we do that work ahead of time to safeguard your relationship and to ensure that you are entering into an agreement, that you are entering into this agreement with your surrogate that is based on your values, your beliefs, type of relationship you're looking for, and we will work with you on that leading up to the point in which you're matched. Our agency is a full service agency in both French and English. We will help you with relationship building. We will find your surrogate places to do ultrasounds. We'll find her a surrogate-friendly obstetrician or midwife practitioner. We will ensure that you're being updated appropriately on the process. We are also Canada's only agency with technology that supports Health Canada's requirements for reimbursement of expenses. And we will ensure that every receipt your surrogate submits goes through this application. We have her sign the declaration for Health Canada's reimbursement of her expenses to ensure that you are safe, to ensure that we are respecting the legislation in Canada around altruistic surrogacy or unpaid surrogacy. That does not mean your surrogacy journey will be free. It means that her expenses, according to Canadian legislation, will be reimbursed, and that you will receive updates on your account and where that money is through our finance team, who as well has French-speaking support with Vicky. And it is so important that as you lead up to this, that you have a chance to ask us the questions, or any agency, and as you're interviewing in agencies and as you're speaking to them, to ask them the questions. Do they have a finance team? Do they have a way to track expenses? Are they using some type of technology to ensure that your surrogate is, signing these Health Canada declarations that are so important? All of that is so important. We will also help with ensuring that your surrogate has life insurance should something happen, that she has a will in place to ensure that if something were to happen, there is a legal document that provides that you are the parents of this child. And then as well, throughout the entire process, we will provide support to your surrogate. We have an on-staff therapist, Jan Silverman, who is brilliant and connects with our surrogates free of charge throughout the process. We have many surrogates who life circumstances change. COVID-19 has been very difficult and a stressful time. We have Jan available, as well as our coordinators, to step in to care for your surrogate through this process. If there's one thing I always want to express, it is that taking care of your surrogate means taking care of your baby. We will help you. We will coach you on how to show up for your surrogate, to ensure that she's cared for, to ensure that she is making the best decisions for your baby, because she has that support. And when women are supported, we know they are able to make better decisions around their health, around their pregnancy. And so we will do that, and anything in between. We will make sure that you as well have resources and information, and our therapist as well, available to talk through, uh, through things when you are ready to celebrate, and also when you need a place to grieve or a place to mourn after a failed embryo transfer or a miscarriage, or all the many things that come up in a pregnancy. We want to ensure that you have that support as well. And so you will have a support person. We will also have access to Jan Silverman to speak with her, as well as other therapists that we work with. Our program has been around for 15 years, and it has been such a pleasure to work with so many amazing clients in French. As you know, in these 15 minutes, I don't speak French, but my staff does, and we will be providing this video with subtitles post webinar. So if you are a French speaker, I apologize. I know I'm a quick talker, but I'm just so grateful that you are sharing today with us and allowing us to share how beautiful this process is. I will finish with this. As a surrogate, as someone who has helped 3 babies into the world for their parents, it has been the most beautiful and breathtaking experience, aside from having my own 5 daughters. And I am so honored that you would even consider working with us as you build your family. So thank you so much for joining us. And I will turn over the screen to Rachel West, a fantastic lawyer who will speak about the legal process in Canada and how her firm can support you.
Hello, thank you, Leia. I appreciate that introduction. I'm just going to very quickly translate just that last part of your discussion for our French speakers, so that they understand that even though you yourself do not speak French, you have many members of your team who do. Alors, bonjour à tous. Je viens d'expliquer qu'on a Leia. Oui, non, elle ne parle pas en français, mais elle a beaucoup de gens avec qui elle travaille sur l'équipe de Egg Helpers ou CFC qui parlent en français, qui sont francophones et qui peuvent vous aider en français. Moi, je parle en français. C'est pas parfait, mais je parle aussi en anglais. Alors, si jamais vous avez les questions en français ou en anglais, je peux répondre à toutes les questions. Moi, je suis avocate canadienne qui est spécialisée en GPA. Je suis ici pour parler avec vous à propos de le processus au Canada en général. Et puis après que j'ai fini avec le processus canadien, je vais vous introduire à Doreen Brown qui va expliquer le processus en Québec, qui est un petit peu différent, c'est spécifique le processus là. Alors, I just introduced myself. I said that I am a Canadian lawyer who specializes in surrogacy and fertility. I'm going to speak about Canada in general, and then Doreen will narrow it down to a Quebec process discussion. I'm not going to translate everything. I will continue on in French, but again, please feel free to contact me if there are any English speakers here. Feel free to contact me, and I am happy to give you these explanations in English. Alors, c'est important de savoir qu'ici au Canada, le processus de GPA, d'avoir une donneuse d'ovocytes, d'avoir une mère porteuse, c'est légal et c'est réglé par le gouvernement. La règle le plus importante ici au Canada, c'est qu'on ne peut pas payer une mère porteuse ni une donneuse pour être une mère porteuse ou une donneuse. On peut seulement payer les dépenses remboursables. Alors ici au Canada, le loi dit qu'il faut être un processus d'altruisme. C'est tellement important. Alors quand on discute un processus de GPA au Canada, vraiment avec les étapes légales, il y a 3 étapes. Premièrement, créer vos embryons. Quelquefois, si vous avez besoin d'une donneuse, ça veut dire que vous avez besoin d'un contrat avec votre donneuse d'ovocytes. Alors, on va rédiger un contrat entre vous, être certain que vous êtes protégé pendant le processus, mais aussi que votre donneuse est protégée pendant le processus. Étape numéro 1 à 2, quand vous avez les embryons, c'est de trouver votre mère porteuse et de rédiger le contrat avec vous et votre mère porteuse. Alors, être certain que vous êtes confortable, protégé et que votre mère porteuse est protégée pendant ce processus et expérience aussi. Alors, on va rédiger le contrat entre vous, on va discuter tout qui va arriver pendant un projet de GPA. Comment est-ce qu'elle va prendre soin de son corps pendant le processus? Est-ce qu'elle peut voyager? On va parler aussi en pire cas. Alors, qu'est-ce qui arrive s'il y a une fausse couche? Qu'est-ce qui arrive si vous voulez demander un avortement? Alors, pour cette raison, le document, le contrat entre vous et votre mère porteuse, normalement, c'est tellement long. Désolée, les avocats. Mais quand le contrat s'est complété, on va tout signer et c'est à ce point que les avocats vont envoyer une lettre aux cliniques pour dire oui, maintenant, vous pouvez faire le transfert. Étape numéro 3. C'est qu'est-ce qui arrive après que votre enfant est né. Alors encore, Doreen va discuter à propos de le processus en Québec parce que c'est un petit peu différent au Québec. En toutes les provinces, en le reste du Canada, le processus, le résultat, c'est qu'on peut obtenir un certificat de naissance avec les noms de les deux parents d'intention. Alors, si c'est deux papas, oui, pas de souci, deux papas sur l'acte de naissance. Si c'est deux mamans, pas de souci, deux parents sur l'acte de naissance. Alors, on peut obtenir un certificat de naissance avec vos deux noms et pas le nom de la mère porteuse. Normalement, pour les parents d'intention internationale qui arrivent ici de quelque part d'autre, le processus, ça va être 3 étapes. Obtenir un ordre du cours qui dit que vous êtes les parents. Cette étape, ce n'est pas toujours nécessaire. Alors, c'est important de parler avec un avocat pour déterminer vraiment si vous avez besoin ou si c'est nécessaire par la province où votre mère porteuse accouche ou pour votre pays. Numéro 2, normalement, la deuxième étape, c'est d'obtenir un certificat de naissance avec vos deux noms ou, si vous préférez, un de vos noms. Et finalement, pour les parents d'intention internationale, c'est un passeport. Vous avez besoin d'un passeport canadien pour retourner à votre pays d'origine. Alors voilà les 3 étapes de la GPA ici au Canada. Et comme j'ai dit, il y a les petites différences entre l'étape dans le reste du Canada et les étapes au Québec. Alors, je vais introduire Doreen qui habite au Québec, qui est spécialisée, elle travaille en GPA au Québec pendant beaucoup d'années. Et elle peut expliquer le processus, c'est quoi les différences entre le reste du Canada et le Québec. So Jordan, I know that you probably are not following along in French. I've just introduced Doreen and said that Doreen is now going to touch on some of those Quebecois issues that are a little bit different. So thank you, Doreen. I'm going to sign off. À bientôt. Bonne soirée à tous, and we'll see you later.
Bonjour tout le monde. J'ai bien entendu tout ce que Rachel nous a raconté. La seule différence, moi, j'utilise le mot femme porteuse et je n'utilise jamais le mot mère porteuse parce que pour moi, de porter un enfant et d'accoucher même, ça ne fait pas de mère. Moi, je travaille dans le domaine depuis 1984, beaucoup avant que la loi est entrée en vigueur et dans le temps, c'était une simple insémination. J'adore travailler avec CFC. Je dois vous dire que c'est l'agence avec qui je travaille très souvent au Québec, comme tout le monde, comme Leia vous expliquait, et il y a des gens une équipe chez CFC qui parle très bien le français. Alors, n'inquiétez-vous pas, vous avez toujours quelqu'un qui peut vous répondre.
Hey, Doreen, I'm just going to stop you for a second. It looks like your mic got disconnected.
Okay, sorry.
There you go.
Okay. Bon, alors, je vais répéter. Quand on travaille avec JPA, que ce soit avec la femme porteuse ou que ce soit avec les parents d'intention, ça devient vraiment une relation personnelle parce que c'est pas comme dans un divorce où il y a des parties adverses. Tout le monde adore travailler ensemble. Au Québec, le processus est un peu différent, pas avant. Selon le Code civil du Québec, article 541, le contrat est nul. Le contrat, ce que je sache, n'a jamais été contesté au Canada. Alors, je ne sais pas qu'est-ce qui pourrait se passer. Au Québec, on ne peut pas relier sur le contrat lui-même pour dire, mais nous avons signé un contrat, pourquoi est-ce que la femme porteuse ne me donne pas l'enfant ou pourquoi est-ce que les parents d'intention ne prennent pas l'enfant. Mais pour moi, comme aujourd'hui, la femme porteuse n'est plus la mère génétique de l'enfant, qu'il n'y a aucun lien génétique, je pense que nous aurions une bonne cause pour aller à la cour. Mais je dois vous dire que depuis 1984, je n'ai jamais eu de problème après l'accouchement. La femme porteuse a toujours été très contente de donner l'enfant et les parents étaient toujours très contents d'avoir un enfant et vous allez rencontrer le dernier enfant qui est né hier, bientôt. Mais avec CFC, vous avez vraiment une bonne compagnie avec qui vous pouvez travailler parce que c'est eux qui vous trouvent la meilleure femme porteuse que vous pourriez trouver, qui pourrait porter un enfant pour vous. Même si le contrat dans le Code civil dit que le contrat est nul, ça ne veut pas dire que c'est illégal. C'est tout à fait légal au Québec. Et je dois vous dire qu'une fois, ça m'est arrivé où le juge a refusé l'adoption parce que ici, si l'enfant est né au Québec, je ne peux pas mettre les deux noms sur le certificat de naissance, seulement le papa, le père génétique, et l'autre parent peut adopter l'enfant. Mais les parents doivent habiter ici au Québec. Le jugement est toujours accordé et surtout depuis 2015 parce qu'en 2012, je suis tombée avec une femme juge qui a refusé l'adoption en disant que le code dit que c'est nul et ça veut dire que c'est illégal. Je suis allée à la cour d'appel et en 2015, j'ai réussi, j'ai obtenu un très bon jugement et la cour a dit ce n'est pas illégal. Donc, la cour ne peut pas maintenant refuser l'adoption. Parce que même si le code dit que ce n'est pas exécutoire, ça ne veut pas dire que c'est illégal. Alors, n'inquiétez-vous pas, c'est tout à fait légal et on ne peut jamais refuser l'adoption. Nous avons une nouvelle loi qui va sortir, j'imagine, très bientôt. C'est le projet de loi numéro 2. Et après que ce projet devienne loi, la loi ici au Québec sera un peu comme en Ontario, où les deux noms puissent être mis sur le certificat de naissance tout de suite, ou on peut procéder avec une déclaration en parentage à la cour. Mais j'attends le jugement, que le projet devienne loi. Après la naissance, on enregistre la naissance de l'enfant et je vais le faire aujourd'hui même avec la petite qui est née hier. Et on met le nom du papa génétique et où c'est marqué mère, on met simplement mère non déclarée. Ça, c'est tout à fait légal, c'est accepté par le directeur de l'État civil parce que c'était quelque chose qui était déjà rendu, un jugement qui était déjà rendu en 2017 en disant ce n'est plus nécessaire de mettre le nom de la femme qui a accouché. Donc, on a un certificat de naissance avec un parent seulement et le père. Et après, l'autre parent peut adopter l'enfant si les parents habitent ici au Québec ou ils rentrent dans leur pays et ils font les procédures nécessaires, que ce soit une adoption ou une déclaration de parentage. Après la naissance, on remplit ce document, on envoie ça au directeur de l'État civil pour qu'il puisse émettre un certificat de naissance. Ça prend à peu près 1 mois après que le directeur de l'État civil reçoive la déclaration de naissance vivante. Et après, on reçoit une lettre du directeur de l'État civil en disant que la naissance était enregistrée et on peut commander le certificat de naissance. On demande que ce soit fait par façon expédiée. Bon, le moment qu'on reçoive la lettre, on commande le certificat de naissance de façon expédiée. Et le moment qu'on reçoive le certificat de naissance actuel, on fait la demande pour le passeport canadien. Et à ce moment-là, les parents peuvent quitter avec l'enfant. Si les parents habitent ailleurs au Canada, c'est très facile. Ils peuvent quitter même avant qu'on reçoive le certificat de naissance. Et après ça, je dois vous dire que je suis très, très, très contente de travailler avec tous mes collègues partout au Canada. Je travaille très souvent avec Rachel et les autres avocats, que ce soit Calgary, Colombie-Britannique, Ontario, ailleurs au Canada, partout. Mais je dois vous dire que travailler avec CFC, c'est quelque chose qui me fait plaisir parce que c'est une agence, comme on dit, a one-stop shop. You need an egg donor, you're going to get the best. You need a surrogate to carry a baby for you, you will have all the help that you need. Donc, je suis là pour répondre à toutes vos questions si nécessaire. I'm here to answer any questions should you wish. So who is next? Oh, I'm going to introduce, I think, is Dr. Liebrak on, Jordan? Hi, Cliff. How are you?
Good, thank you.
Alors, tout le monde, je veux vous présenter Dr. Clifford Liebrak. Il travaille à la clinique Create à Toronto. Je travaille avec lui très souvent depuis des années et I consider him a friend. Même si Dr. Liebrak va vous parler en anglais, je dois vous dire qu'il a une équipe qui parle français. C'est une excellente équipe, c'est une excellente clinique. You will be served beautifully. So Clifford, it's very nice to see you.
Nice to see you. Thank you so much for that introduction. It's just a pleasure to be here and with these amazing people, these lawyers and agencies that do such incredible work and help us to do all the medical, make it easy for us to do all the incredible medical things to help you create your beautiful family. So I really am so pleased and thrilled to be here. So I'm Dr. Clifford Liebrak. As Doreen mentioned, I'm the director of the Create Fertility Center in Toronto. It's in downtown Toronto, and I'm a full professor at the University of Toronto. So I'm really, one of my mandates is to be on the cutting edge, to do research, to learn new things so that we can be the best of any clinic in the world. And I feel like we are. And we're the largest fertility clinic in Canada. And we also have by far the largest third-party program in Canada. And I dedicated a large part of our clinic to it because I think it's such an important and underserved area in the fertility world. We actually have 17 nurses that are just dedicated to that program. We have 7 administrative people and all of our quality control people. So we really have dedicated a large portion of our clinic to this provision of third-party reproduction to people that need an egg donor and a surrogate to have a baby. And I'm just going to sort of and by the way, we do have bilingual nurses and administrative people that can help you if your English fluency is not great, and we can help you in your own language that you prefer. I just want to briefly say some of the things that we do to help you have a baby. We start with an initial consultation by myself, a doctor, and then we look at your medical background, and basically then talk about, whether you need an egg donor and a surrogate. We help all different people that need third parties, same-sex male couples, single men, heterosexual couples, as well as single women. So whoever would require an egg donor or surrogate, we can help them in any way that we need to. And we talk about the egg donor in terms of all the issues that are related to finding a donor and some of the psychosocial issues which our counselors will go through. And we have 5 dedicated counselors in our program that all help us to give that kind of psychosocial counseling. And then we talk about the surrogate and all the aspects of screening a surrogate. Surrogates must already have children, they must be healthy, and they must have no trouble to give birth. And we also talk about the how you choose a surrogate and some of the very important things that are involved in surrogacy. Also, if you are a same-sex male couple, you are most people do make embryos for both people, not all, but many do, and we are able to do that so that you can have a child that has this genetic, that are sort of half siblings from the same donor for each of you, and that's a pretty incredible thing that you can do with our program. And you also, for your first transfer, you can either choose one of you to be the first person's embryos that would go in, or you can just say, Dr. Lieberach, pick the best one and we'll make a surprise. And of course, on the next child, we can pick the other person's embryo. So I'm going to stop there because I know that Leah wants to ask me some questions and guide you for some of the things that she gets questions about regarding the medical aspects of this.
Hey, Dr. Lieberach, it's great to see you.
Good to see you.
So ahead of time, we sent an email out to many of our clients to ask them what questions they would have wanted to ask you ahead of time. And so I have a few of those questions here. And one of the questions was, this is a new question from a client. They are currently working with a fertility clinic that has a 6-month wait list to get started and meet with the doctor. And they wanted to know how quickly a consultation is possible with yourself or one of your colleagues at your clinic.
Well, we really try to see people as quickly as we can. So I try to see people within a month or two of the referral. And also we have dedicated nurse practitioners that will also see your surrogate and your donor as quickly as possible. So we have a big team of people that are going to make sure this goes as quickly as possible. Obviously, there are variation in finding the donor that you want and the surrogate. There's going to be different kinds of aspects that are going to make it quicker or slower. For example, if you pick a donor, it's their first time, it's going to take a bit longer to screen her. If it's their third time or whatever, then we'll have most of the information we need at the beginning. And the same for surrogates, finding the right surrogate, the person that you both want to work together can take time, and sometimes it can go quite quickly.
Excellent. The next question I have, and I know I want to preface this by saying this information is as of today, January 16th. We had many clients ask us if now is a safe time to achieve a pregnancy with COVID-19 and sort of all of the limitations around health and appointments and all of that.
Well, we feel it definitely is. And I think, the data shows that if you're vaccinated and you're boosted, then you're, especially with the new variant, it's a very mild condition. And we do not recommend people waiting to conceive during this time. We will treat you the same, whether you're vaccinated or not. We hope you will be, but we will make sure that you come to a very safe environment in our clinic. And we do keep social distancing. We use masks. I don't have it on right now, but I always wear it in my clinic. And also we screen everyone at the door. So we're very, very careful, but I also think it's very safe. And the nice thing is that COVID seems to not affect the pregnancy in a negative way, at least the new variant for sure.
Excellent. And then the follow-up question to that is, for our intended parents who live outside of Ontario, within Canada or abroad, is there a possibility for them to do this all remotely for a same-sex male couple or for someone working with an egg donor in terms of the screening process? Even is it possible to send their sperm to you? What does that look like?
That's an excellent question. And now with travel being more restricted, yes, all of our consultations are done online, including all of our nurse practitioners. Of course, for our donors and surrogate, they must come here because they have to have physical examinations and so on. But for the couple that is, if they're not carrying the baby, of course, if they're carrying the baby, we do have to screen them as well. But if they're not carrying the baby themselves, and for, of course, same-sex male couples wouldn't be, so they can absolutely send their sperm here without having to come. And we have a kit, we developed a kit that we're about to patent actually, that we can send to you. You can actually freeze your own sperm at home through this kit with an amazing video that helps explain it. And then you just have to have someone take blood and then you can ship it back to our clinic. But you do have to come here to pick up your baby, that we can't ship the baby.
Yes, and we will hear from Eric and Jerome next who, you know, are here picking up their baby. So absolutely, that's great. And then my last question is, can you talk a little bit about, we had people asking about PGTA and why the clinic that they were working with said they have to send the sample away. And I know at Create, you do it right there.
Yeah.
Can you find out the gender, or is that not a thing? And if you can't find out the gender, what is the point of this test?
Okay, that's a great question. We actually have one of the most advanced pre-implantation, meaning before implanting the embryo, genetic testing facilities in the world. In fact, we just published a paper in the most highest level journal in medicine, the New England Journal of Medicine, from our lab. And so we can do this very easily in-house. And if people ask, well, they're young, you know, maybe everything would be normal. But in fact, we've done thousands and thousands of embryos and young egg donors, and it turns out about 30% of them on average will be abnormal. In other words, those are embryos that are just going to fail, they're going to miscarry, or potentially even an abnormal child. And so we can test those so easily to eliminate those. And that's better for your surrogate too, because she doesn't want to go through all of that. And she's going to be more attracted to work with you if she knows those embryos have been tested before they go inside her. So many surrogates they really want that. And I think that's an important thing to protect your surrogate from going through negative types of pregnancy complications. And we also have another technology called the EmbryoScope, which I won't go into detail, but it's a cool sort of time-lapse technology that allows us to choose among the normal embryos which ones to go inside. And one last thing is, if you do have a family history of a genetic condition, we can test for that embryo, that in your embryo, no problem, as long as we know what it is, and we can prevent that from being passed on to the next generation.
Okay, excellent. And intended parents, this is what I was speaking about at the beginning, that shared value around termination. This is a way to safeguard against ever having to make that decision, or, you know, it's insurance, which I think is really important. And for us as an agency, we really believe in clinics that, you know, that we can come back to and say, hey, you did that testing. Not that you sent it away to a company in the US and then it was sent back. I mean, can you imagine, these embryos are so fragile? And, you know, I know that they're taking cells from them and it is safe. However, for me, I really feel having this all done in one place just adds that added layer of insurance or protection. And then the final question, Dr.
One more thing to add to that is that we can't test for everything. There are rare things or things that are not genetic, but it's about 95% of abnormalities are tested by that test.
No, that's fantastic. Dr. Liebrecht, what one, as we're finishing up, what one piece of advice would you have for intended parents who are considering surrogacy and egg donation from a medical perspective?
You know, I think the main things you want to do is do your research, go to a clinic. I hope it'll be ours, but one that does this a lot. Because if you just go to a place that does very few cases, they're just not, it's very difficult to do this, even more so now in Canada, because there are new regulations. And we took a long time to be able to get very comfortable with the regulations and all the paperwork. So we're doing it in the proper way. And we feel that we can provide the best service because we have such a large team to do this in a way that's safe and also gives you the highest chance of success.
I 100% agree. Last month alone, we had just over, I think it was 36 embryo transfers at Create. And so for us, the success is in duplication. The success is in knowing, how to get women pregnant through fertility treatments who aren't infertile. And that sounds like it would be easy, and in some ways it is, but in other ways it's really, it's finding the way and then duplicating it, and then taking it to that next level with all of the most cutting edge technology and processes. So it's been, over the last 15 years, I have, likely done 80% of my work at Dr. Liebrecht's clinic. And that's because we have seen such great success. And, more important, or not more important, as important for me, as I'll go back to the point I made earlier about caring for your surrogate and caring for your donor, the question to ask your clinic: how are you caring for the surrogates? How are you caring for the donors? It is so important that your donor has access to a nurse 24 hours a day, which they do at Create. It is important that your surrogate has a counselor at the clinic, should she be there for a test or an appointment and really just be struggling, cold feet, nervousness, excitement, just wanting to unpack her feelings around what's coming next. It's so important that your clinic has done this so many times that they know how to keep your donor safe. They know how to not, pump her with medications with no care or concern, which I've seen, because some clinics think we want all the eggs. Not, we want a safe number of eggs to turn into a safe number of embryos to ensure that there are enough embryos to transfer and that the donor as well. And, I came to Dr. Liebrecht 5 years ago and said, we're only going to transfer one embryo. We don't need twins anymore. It's not safe. And, I wasn't sure. And we had a few conversations back and forth, and he agreed. And for many of you who have been at this for a while, at clinics that may not have the success, they may not have the advanced testing of the embryos and all of these pieces where they are still putting in 2 and 3 embryos, it's not required anymore. It's safest for your surrogate to carry one baby. It is safest for your children to be born individually. For many people, twins looks, very appealing from a financial perspective. But I want to tell you, when we look at twins and we look at people who live outside of the location where your surrogate is, and you're now here for 4 months because your babies are born early and you have a large hospital cost and your babies are unwell and your surrogate has just suffered, terribly through a pregnancy. It is why we as an agency partner with clinics who get that your surrogate's health is important, get that your future children's health is a primary concern, and as well financially provide programs that will guarantee some success, that will guarantee success, that will, allow you to transfer one embryo at a time from a financial perspective. And so as you speak to clinics, ask them, will you put your money where your mouth is in terms of a guarantee? Will you, and how will you keep our surrogate safe? So again, back to those questions you want to ask providers.
I'll just say at our program, we have a guarantee 1 baby, if that's your goal. We have a guarantee of 2 babies. And for same-sex males, we have a guarantee of 1 baby each. And so we are standing behind our quality to be able to provide that baby, or you'll get your money back. And we want to give you the baby, not the money back. So we're going to work really hard to make that happen. And I want to echo what Leia said about the donors and the surrogates. I love working with the donors and the surrogates. They are such incredible people that they're doing this to help someone else. And, in Canada, as we said, it's altruistic, and they get their expenses. It won't cost them money, but the fact that they are doing this to help someone else, they are just incredible people. And I need to protect the health of every single person involved in this. in every way possible because I'm their doctor, every one of them. And I have that obligation to do everything possible to have a healthy mom, healthy donor, and a healthy baby, and incredible results for our parents.
Absolutely. Thank you so much. So Jordan, we will move next to Eric and Jerome, who had their baby yesterday. They are a great success story and amazing people. And I'm hoping, because they're still in the hospital, there we are. Excellent.
Hello, Leia.
Hi. So Jordan, if you want to take me off screen, because they're going to speak in French, and hopefully we're going to see baby Augustine, but I don't need to be on this one for sure.
Bonjour tout le monde. Je suis très heureux de vous retrouver. J'espère que vous allez bien. Alors, vous l'avez compris, nous venons d'avoir un petit bébé hier. Elle s'appelle Augustine. Elle va très, très bien. Nous avons fait un parcours de GPA, comme on dit. Alors, vous avez entendu, je ne parlais pas anglais. La question qu'on me pose souvent, c'est est-ce qu'on peut faire ça si on ne parle pas anglais? Eh bien oui, vous voyez que c'est possible. Et si vous avez écouté tous les précédents interlocuteurs, vous remarquerez qu'il y a souvent des gens qui parlent français dans chaque étape de ce parcours. Donc vous allez pouvoir vous sortir. Et puis maintenant, avec Google Traduction, on arrive à tout. En tout cas, c'était sympa de revoir les gens avec qui on a eu ce parcours, nous, avec Jérôme, le docteur Librac, pour Create, bien sûr. Alors toute l'équipe CFC, forcément. Helpers aussi, et puis Rachel et Dorine qui sont les deux avocates qui s'occupent de nous, puisque nous sommes à Québec, au Québec actuellement. C'est l'hiver, il fait froid, et Augustine a décidé d'attendre un ressenti à moins 32 pour pointer le petit bout de son nez. Elle est arrivée hier à 13h, donc vous voyez, elle a une journée et deux heures. En tout cas, voilà, on est deux papas ravis, très heureux, et on est surtout l'exemple que ça fonctionne, que ça marche. Alors moi, je reçois beaucoup de questions. On a créé avec Jérôme un compte sur Facebook et sur Instagram qui s'appelle Deux Papagais, et vous êtes nombreuses à me poser plein de questions. Il y en a plusieurs. Il y avait le je parle pas anglais, est-ce que ça peut marcher? Il y a aussi comment ça se passe, quel est ce parcours, combien de temps ça dure, quel est le budget, voilà, toutes ces questions qui sont légitimes. Alors, il y en a certaines auxquelles on ne peut pas répondre puisque ça dépend du parcours. Pour le budget, par exemple, oui, une GPA, il y a un petit budget, c'est certain, mais ça se fait, ça s'organise, ça se prépare. Et puis, il y a différents choix dans le parcours qui font que on ne peut pas répondre à cette question très clairement. On pourra vous donner une fourchette et pour ça, je vous laisserai contacter l'équipe CFC. Combien de temps? Là encore, on ne peut pas répondre parce que c'est comme, j'ai envie de dire, nous sommes un couple gay, c'est comme pour un couple hétéro qui fait un bébé de façon traditionnelle, on va dire, plus logique. Ça fonctionne, ça ne fonctionne pas. Voilà, il peut y avoir différentes étapes, différentes choses qui font que le parcours est plus ou moins long. En tout cas, je dois avouer qu'avec Jérôme, nous avons beaucoup de chance puisque nous, notre parcours est allé très, très vite avec CFC. On pensait très sincèrement que ça serait plus long. Voilà, donc on a eu beaucoup de chance, c'est allé très très vite. Et puis comment ça se passe? Vous l'avez compris, hein, il y a différentes étapes. Moi, ce que je vous propose de faire tout simplement, c'est de prendre contact avec l'équipe CFC qui saura vous renseigner et qui vous mettra en contact d'elle-même avec des avocats. Alors, j'embrasse Rachel West qu'on a eu juste avant, puisque c'est notre avocate et qu'elle est juste exceptionnelle et qu'elle a un cœur gros comme ça. Et puis, ils vous mettront en contact avec la clinique, voilà, avec les différents interlocuteurs pour une GPA. En tout cas, voilà, ça fonctionne. Nous sommes ravis. Ashley, notre femme porteuse, va très bien. Certains d'entre vous la connaissent peut-être, puisqu'en fait, Ashley a rejoint l'équipe CFC il n'y a pas très très longtemps. Alors, quand on s'est rencontré avec Ashley, elle n'était pas encore dans l'équipe CFC. Et puis, elle a rejoint l'équipe CFC. Elle est l'interlocutrice, votre interlocutrice pour les parents intentionnels qui souhaitent plus tard devenir papa ou maman, eh bien, elle sera votre interlocutrice privilégiée puisque c'est elle qui sera votre contact francophone au sein de CFC. Alors là, elle est en pause puisqu'on a eu un accouchement un petit peu difficile hier, un accouchement très long. Elle devait être présente aujourd'hui. Elle est dans une chambre juste en face puisque nous sommes à l'hôpital actuellement. Elle est très fatiguée. En tout cas, voilà, elle vous embrasse toutes et tous. Et dès qu'elle reprendra le travail, courant février, elle sera ravie de répondre à vos petits emails, à vos questions. Voilà, nous aussi avec Jérôme, on sera ravis de répondre à vos différentes questions via notre page de Papagay. On fait beaucoup. Voilà, n'hésitez pas. Alors, je vais peut-être vous présenter notre petite Augustine quand même, parce qu'elle est là et que je suis très fier et que nous sommes très fiers. Et encore une fois, un immense merci à Ashley. Parce que voilà, sans elle, c'est clair que cette histoire n'était pas possible. Je pense que les femmes qui font ça méritent tellement, mais tellement d'amour, de respect. C'est tellement beau. Alors voilà, regardez, il y a Jérôme qui arrive. Je vais essayer de tourner la caméra quand même. Bonjour Jérôme.
Bonjour.
Et voici notre petite Augustine qui est née hier. Elle est trop chou. C'est la plus belle. Vous imaginez bien qu'on la trouve la plus belle du monde. Tu veux venir, ma chérie? Tu veux venir, mon amour? Viens voir. Voilà. T'es trop belle. Elle fait 3 kg 706, c'est ça, Jérôme? 51 cm. Et voilà. Et ça, c'est le fruit d'une relation qu'on a nouée avec Ashley, notre surrogate. Moi aussi, j'aime pas le thème mère porteuse. J'utilise femme porteuse. Je pense que ça correspond très bien et qu'avec Ashley, on est très clair. On a noué, nous, une super relation avec Ashley. Nous habitons chez elle. Alors là, on est à l'hôpital, mais sinon, nous habitons chez elle. Et vraiment, ce parcours, alors, est parfois semé d'embûches. Parfois, il y a des petites choses qui ne fonctionnent pas. En tout cas, il y a des montagnes. Il faut profiter de chaque instant. Dans les coups durs, n'hésitez pas peut-être à nous envoyer un message. On essaiera de vous rebooster. J'aime bien aussi les bonnes nouvelles et on en reçoit aussi beaucoup. Voilà, en tout cas, nous, on est ravis de ce parcours. On envisage un second parcours parce que Augustine aimerait bien, je pense, avoir un petit frère ou une petite sœur un jour. Voilà. En tout cas, voilà. C'est l'histoire de notre vie. On est très, très fiers de ce parcours GPA. On remercie, mais vraiment, mais tellement toute l'équipe CFC. Leia, thank you. Thank you, Leia. I love you. Alors, moi, vous avez vu, j'ai réussi à parler alors que depuis 24 heures, je ne fais que pleurer. Je pleure beaucoup. J'avais peur de pleurer là aujourd'hui, mais j'ai pas pleuré. Je suis très content. En tout cas, voilà, Augustine est là, c'est la plus belle du monde. Merci à toutes et à tous. Et voilà, n'hésitez pas si vous avez des questions, voilà, contactez l'équipe CFC. Vous pouvez aussi passer par nous. Moi, je vous mettrai en relation. Enfin, il n'y a aucun souci. Voilà. Merci tout le monde. Et voilà.
I have questions for you.
Alors, Leia, le son est pas bon. The sound is not good. Okay.
Can you hear me now? Can you hear me now?
Jordan?
I
Jordan?
can
Jordan arrive, ok.
Can you hear Leia?
Ah, mais c'est peut-être moi alors qu'il y a un problème de son. Alors, quelle est la question?
Yes. What advice would you give people about this process?
Est-ce qu'on peut me traduire en fait techniquement? J'ai un problème de son, je vous entends en version très ralentie, c'est très étrange, je ne sais pas pourquoi.
Rachel?
Bonjour, alors je viens d'écrire.
Ah, Rachel! Ah oui, j'ai un problème.
Ok, pas de souci. So,
Okay. J'ai un vrai problème de son, c'est au ralenti, je ne sais pas quoi vous dire.
Est-ce que vous pouvez m'entendre?
Oui, je t'entends Rachel, mais parle lentement, je t'écoute. Sinon, je vais enlever mes oreillettes.
Pas de souci, parce que je peux entendre Leia, alors je peux traduire et puis demander les questions. So Leia, I can hear you, he can hear me, I think we're okay.
Okay. What advice?
Sorry, because the sound is not good and sorry.
Non, ça va. Est-ce que vous pouvez m'entendre? Ça va?
Je suis désolé, je vais me déconnecter, je me reconnecte.
Okay,
for you?
He's going to hang up and just reconnect.
My question, Rachel, is just what advice would he give to people considering surrogacy to avoid some of the pitfalls and bumps that he mentioned along the way?
The bumps that he's experienced.
Yes.
And yeah, so I'll absolutely ask him that. I know that he and Jérôme have also an Instagram account where they talk about some of that stuff as well.
Okay.
Alors, je viens de dire que Eric vient de dire qu'il y a un compte de Instagram où il parle tout partout de l'expérience et les montagnes et les problèmes pendant le processus. Mais oui, ils discutent tout. Et je pense aussi qu'ils répondent à les questions des gens qui demandent par Instagram aussi, s'ils peuvent répondre à les questions. Alors, ça va peut-être? C'est mieux?
Non, Rachel, le son est très très long. Il doit y avoir un souci technique, je sais pas, de ma
OK.
part. Sinon, écrivez-moi la question sur le petit chat et j'y réponds avec plaisir, tout simplement. J'ai
Je
le
peux
petit chat qui
écrire,
est affiché.
oui, je vais écrire par WhatsApp peut-être. Ça va?
Sorry.
Votre avis?
Technology.
Alors mon avis sur
Ouais,
mon parcours de GPA pour nous, pour les parents, je
exactement.
pense qu'il faut y aller, il faut se lancer, il ne faut pas hésiter. Euh, on rencontre des personnes exceptionnelles, on vit des choses folles, folles. C'est un mélange de tellement de sentiments. Tu veux me faire pleurer en fait, Rachel, c'est ça? Tu voulais que je pleure, hein, c'est ça? Ça ne marchera pas. Euh, c'est un parcours tellement beau, tellement exceptionnel. Nous sommes les plus heureux du monde depuis 24 heures. Nous sommes tellement reconnaissants auprès d'Ashley qui a été exceptionnel. Et voilà, c'est un vrai parcours. Nous sommes deux papas, nous sommes une famille. Et j'ai envie juste de dire tout simplement un truc très bête, hein, mais croyez en vos rêves. Parce que nous, on s'était dit qu'on ne pourrait jamais être papa, que c'est quelque chose qui ne serait pas possible. Eh ben, si, puisqu'on l'est aujourd'hui, donc ça peut marcher. Voilà, donc vraiment, c'est une aventure extraordinaire. On est ravis, voilà, oui, non, à l'hôpital. C'est une aventure si belle, si merveilleuse. Et voilà, notre avis, il est plus que positif. On a vécu de très belles choses. Et je vous le disais, on a eu cette chance aussi que tout fonctionne du premier coup. Je veux dire, voilà, Ashley a eu son transfert d'embryon avec une donneuse que nous avons eue avec Egg Helpers. Le transfert d'embryon a fonctionné du premier coup. Le match avec Ashley a été très rapide. Je ne sais pas si vous connaissez le système du match. Avec CFC, c'est très simple, hein, en fait. Vous recevez en tant que parent intentionnel des profils de femmes. Vous dites, ben voilà, celle-ci, elle me plaît bien parce que ceci, parce que cela, parce que voilà, je la trouve sympa, je sens qu'il y a un feeling sur ce profil. Vous vous positionnez. Alors, c'est pas vous qui choisissez la femme porteuse, c'est la femme porteuse qui va vous choisir, c'est important de le dire. Et après, il y a ce qu'on appelle donc le match. Vous êtes mis en relation. Vous avez 10 jours, je crois, pour vous contacter, faire des petits WhatsApp, des petites vidéos, des petits messages. On fait connaissance, tout simplement. Et puis au bout de 10 jours, eh bien, on se dit, OK, c'est super, c'est avec elle que je veux faire ce parcours parce qu'elle est super, parce qu'elle est géniale. C'est ce qui s'est produit avec nous et avec Ashley. Ashley se dit, OK, les garçons, là, Eric et Jérôme, ils sont top, ils sont gentils, je veux faire avec eux. Ça fonctionne dans les deux sens à chaque fois. Et puis à l'inverse, il peut aussi bien du côté de la femme que des parents intentionnels se dire, bah voilà, elle est adorable, ça se passe bien, mais on le sent pas. Ça peut arriver. Bah dans ces cas-là, il faudra un autre match. Il n'y a aucun problème. Voilà. Et ce système de match, il dure environ 10 jours. Alors, pour la petite histoire, avec Ashley, ça a été validé en 3 jours. On n'a même pas attendu les 10 jours parce que c'était génial et parce qu'il y a eu vraiment ce feeling qui est passé immédiatement. Voilà, j'ai un sourire comme ça parce que je suis papa.
Je me souviens quand vous avez senti un vrai match. Alors, c'est super. So Leah, he's just saying that his advice is to get going because you don't know how long it's going to take. You don't know
Alors,
if you're going to get a match right away. They felt so lucky. Vous avez senti si chanceux de trouver Ashley un match assez rapidement. Mais ce n'est pas toujours comme ça. Alors, votre avis, c'est de commencer maintenant, aujourd'hui.
Excellent. Well, thank you. We're going to bring everyone on now to answer questions that Jordan's got. You know, I am a mom of 5 and never thought I would see a baby and just, but here I am. Dr. Librak and I are texting back and forth about how cute this baby is and how.
But she's not answering any questions.
I know. Speak to her publicist.
Yeah. Yes.
Thank you.
Okay.
Thank you
No,
very
no,
much.
no.
Bye.
I think
Attends, restez en ligne. Non, restez en ligne.
I think we all had tears in our eyes when we saw your baby.
Yes, we did.
Restez.
That's what all this is about.
Yes. So let's get to our questions. Jordan, do you want to get to questions? I have the English ones. Dr. Librak, question for you. It says our surrogate will go for screening next week. We will have blood tests and endometrial biopsy. How long can it take to get the results?
So generally, when we do surrogacy screening, we do the initial consultation, that's online. But with the screening that we do in-house, usually about 2 weeks or so, not that long. And then once the results are ready, your nurse who's looking after you, your liaison for the process, she will let you know that the surrogate's passed her screening, and then you can start doing your legal contract.
Is that usually a month or 2 months?
I would say 2 or 3 weeks in general, because the testing doesn't take that long. Yeah.
Okay, perfect. Another question for you. It says, Dr. Librak, could you explain more on embryo testing and their results with the risk of transfer, such as difference between a normal, abnormal, and mosaic embryo and transfer success?
Okay, so that's a great question. A normal embryo has 46 chromosomes. An abnormal embryo has too many or too few. So, for example, if there's an extra 21, that would be trisomy 21 or Downs. If there's too few chromosomes, that means there could be a severely abnormal child or miscarriage or just no pregnancy at all. So these are the ones that we eliminate by doing this testing. A mosaic embryo is a bit of a different, it's sort of an in-between result. It means that some of the cells in the test were normal and some were abnormal. But all babies in the world from mosaic embryos have been normal, including many from our clinic. In fact, we have the largest series of mosaic embryo transfers in the world that we're about to publish. And I just did an international webinar for doctors on this subject. But they do miscarry a little more often, so they're always like our second choice. First choice is normal, second choice is mosaic.
Excellent. Thank you. Jordan, or actually Rachel, I know that there's some questions here in French. If you could send them to us or tell us who they're for.
Oui, bien sûr. Et je vais expliquer, je viens d'essayer d'écrire les questions pour Jérôme et Eric à eux parce qu'ils ne peuvent pas nous entendre. So I just translated to say that I've been sending via WhatsApp the questions that we have for Eric and Jerome because they cannot hear us. So they can see. But yeah, so for everybody else who's on the video right now, we can still hear you. So just stay quiet. You're not muted, even if you think you are. And I had explained that as well to Jerome and Eric. OK, je vais... quels seraient les conseils que tu donnerais? Je pense que c'était pour Eric et Jérôme. Des conseils, oui. Est-ce que vous avez essayé avec une clinique du Québec? Je peux répondre pour Eric et Jérôme aussi. Non, ils ont travaillé avec Dr. Librak et Créade. Alors, ils n'ont pas travaillé avec une clinique au Québec. So they just asked if Eric and Jerome worked with a clinic in Quebec. The answer is no. They worked with Dr. Librak and the Create Clinic. Désolé. Pour Eric et Jérôme, il y a une question là. Je ne sais pas si vous pouvez m'entendre. Combien de temps est-ce que le processus a pris? So how long did the process take for you, start to finish? Eric and Jerome. OK. Je peux peut-être répondre à cette question parce que j'étais là pendant le processus. C'était environ une année. Alors, entre le temps qu'ils ont commencé de créer leur embryon à aujourd'hui, maintenant, où Augustine est née, c'était environ une année, mais c'était un processus tellement rapide. So my answer to that was just that it's been about a year for Jerome and Eric, but they had a very, very fast sort of matching process. So it was a very speedy journey for them. So I'm just answering the question for them because I don't think that they can hear me, but I was involved throughout all the steps, so I can assist a little bit there.
And Rachel, just for average, we would say that on average, people who reach out to us from the date of selecting an egg donor, if they require a donor and a surrogate, from the date of egg donor selection to the date of birth, typically is a 20-month period.
OK. Alors, normalement, si vous avez besoin d'une donneuse, au moment que vous avez choisi votre donneuse, normalement, la moyenne de parcours de GPA, ça prend environ 20 mois. That helps. And I think that's all for the French questions that I can see.
I see an English one. How many surrogate mothers do we have? Well, currently we have, I believe, just over 100 women pregnant, and from the beginning stages to up to 3 months postpartum, which is how long we hang on to people, ensuring that they have all the support that they need. We have just over 300. So it's very busy. And yesterday alone, we had 3 babies born, one in BC, one in Ontario, and then Augustine in Quebec.
Alors, ce que Léa vient de dire, c'est que ça dépend moment de moment. Alors, c'est environ maintenant, c'est 300. 300 mères porteuses de femmes porteuses, comme Eric a dit, mais ça dépend moment à moment. Et ils ont eu, je pense qu'elle a dit 3 naissances hier, 3 accouchements hier, un en Colombie-Britannique, un en Ontario et un au Québec, c'était Augustine.
I would say that I did 4 transfers yesterday and 3 today for surrogates, just alone, the last couple days.
Alors, Dr. Librac vient de dire qu'il a fait 3 transferts hier et 4 transferts pour la porteuse. Il vient de faire, was that today, Dr. Librac?
Yeah, 3 today, this morning, and 4 yesterday.
4 hier et 3 aujourd'hui, c'est ça ce qu'il a dit.
And a similar amount of egg donor retrievals, I believe, if I'm keeping track.
Presque le même pour les donneuses, voilà.
I see there's a question from Victoria.
Yes.
A comment saying, I hear it is possible in Quebec. She's happy, but her doctor in Montreal mentioned it would be easiest to go to Ontario. Are there many surrogates in Quebec in CFC? It is easier at the end process after the birth to have the baby born in Ontario because there's no adoption. Should our law change, it will be easier in Quebec, but it is very easy anyway. All you have to do is an adoption and the baby is with you from day one. And I can say personally that I know, I'm working with CFC, there are many Quebec surrogates for CFC. Ça fait longtemps déjà que CFC travaille avec des femmes porteuses au Québec. Et il y a beaucoup de femmes qui veulent être femmes porteuses.
We believe so strongly in the intimacy of the relationship that you will have with your surrogate. And it brings me tears because you, Victoria, deserve that. You deserve to be at appointments. You deserve to be included. You deserve to be the mother of your child at every doctor's appointment, advocating for your pregnancy as you will for your child when they're here, and being able to be close and share those appointments if possible. Doreen says it's easy, and for me, you know, there's nothing easy about parenthood, but if you are able to start, if you are able to have those moments at every ultrasound and every appointment with the doctor, we want that for you, which is why we have, you know, grown our French program, because we do know how important it is to be a part of your pregnancy, because this is your pregnancy from the beginning. And so whether that's a surrogate in Ontario or a surrogate in Quebec, we as an agency and any agency you work with should truly want to support that for you. Marc-Andre. Oh, no, Doreen, do you want to answer Kevin's question?
What was Kevin's, do you think that the PL2 will be? No. Okay. I see what Kevin's question is. No, if the baby is born before the law comes into effect, si l'enfant est né avant que la loi entre en vigueur, on va travailler avec le système que nous avons présentement. We will do an adoption the way it is now. I believe even if the baby is born after the law comes into effect, le fait qu'on a commencé avec le contrat et que la femme porteuse est déjà enceinte, on va procéder avec la loi telle qu'il est maintenant. So we would proceed even if the baby is born after the new law comes into effect. I think we would probably either proceed with an adoption because the pregnancy had already taken place prior to the law, or we would be able to proceed with a declaration at the court, basically a declaration of parentage, which is something that exists in many of the other provinces and Ontario as well. I think Rachel, you do a declaration.
That's right. Yeah. So we need to do.
It would be the same as everywhere.
Yeah. Yeah. It's a very normal and common process.
Mark Andre's question, the average budget. I'd love for you to email me separately. There are so many aspects to that, whether someone requires an egg donor, whether they are doing it, whether they have embryos already. My goal with clients is to work to find the money. And so whether that's through your employee health plan that offers alternative family building money, whether that's through your drug plan, because these medications used on your surrogate or donor are for your benefit. And we want to make sure your drug company acknowledges you around that piece. We want to make sure you work with a clinic who understands the importance of that. We also want to make sure that anything that you are able to do, whether it is creating a health spending account if you are self-employed, whether it is advocating with your employer to cover more. I would say the average client spends $80,000, which when we look at the cost of a private adoption in Canada, the average private adoption costs $65,000. So it's similar. However, we will work with you to find whatever money we can through these pieces that I mentioned earlier. Is there any possibility to get twins? I mentioned twins earlier. I would never put a woman to jump out of a plane without a parachute, and I will never put a woman in a situation to carry a pregnancy that may not be safe. However, we have many intended parents who do what is called a tandem journey, which is having two surrogates at the same time or at similar times to have two children very close together. I know that for many of our clients, they feel as though their age is a deterrent, or they're wanting to build their family quite quickly, and we support that. And when we've looked at the cost of a tandem journey versus a twin pregnancy, we're at the same amount. With twin pregnancies, we were seeing an average of 15 weeks of bed rest. And with 15 weeks of bed rest comes 15 weeks of wage replacement, childcare, and additional expenses. And so we found that by having these tandem journeys, that we were able to eliminate that and come very close from a financial perspective. And we would love to share that information with you through a consultation as well.
Leah, there's a question from Philippe Asselin for me.
Okay.
He says, quels seront les changements avec la nouvelle loi québécoise pour le processus de la femme porteuse? Bon, il y a des changements que nous avons demandés. Je siège aussi sur le comité LGBTQ au Québec. C'est une comité au barreau de Québec. Et la loi prévoit des changements pour les gens gays et les trans. Et aussi, c'est pour les JPA. À la fin, le processus sera vraiment comme en Ontario. C'est un processus administratif où les deux noms des deux parents peuvent être inscrits tout de suite sur le certificat de naissance ou une déclaration de parentage comme ailleurs. Il y a la protection et le contrat sera tout à fait légal. Donc, il demande présentement, le projet de loi demande que le contrat initial soit rédigé par acte notarié. Ça, je ne sais pas pourquoi, parce que ailleurs, c'est devant 2 témoins, c'est pour un avocat peut faire tous les autres documents. Alors, on attend le changement, mais le changement important, c'est que le contrat sera complètement légal et exécutoire. Et les 2 noms peuvent être inscrits tout de suite sur le certificat de naissance.
Jordan, is that all of the questions? Jordan is our main host, and so I don't know if she has any questions aside from the ones that we have, or if that's it.
Well, hi, so that's everything that's come in through the live chat. Just a lot of thank yous coming in now. So I just wanted to say thank you again to everyone.
Excellent. Thank you, everyone who joined us today. If you have any follow-up questions, you will be receiving an email with contact details for all of us. It is such a pleasure to share with you this beautiful gift that we have been entrusted with in sharing your journeys. We do not take any of that for granted. We truly honor you and are so excited that you are even considering becoming parents. As we know, as the presenters here know, as parents and grandparents, what an amazing gift parenthood is. So thank you for allowing us to even be a small part of it. And I hope that you have a blessed Sunday.
Leah, there's one more question. I see
Sure.
André-Anne Martel asks for les coordonnées pour avoir une rencontre. She wants to have the numbers or emails to have a first meeting. And I don't know if it's with CFC, Rachel, me, Dr. Liebrack.
Okay.
I don't know who she wants to have the meeting with.
Okay.
So
Jordan will send. Yeah, Jordan will send out all of that information with all of our contact details.
Yeah, and everyone
Juste à dire, alors, Jordan va envoyer les détails de contact, les coordonnées pour tous les gens qui ont parlé aujourd'hui, puis vous pouvez mettre en contact avec eux.
Everyone will also get a recording of today's video with English and French subtitles.
Oh, great.
Yes. Excellent. Thank you, everyone. We'll see you again
Bye,
soon.
everybody.
Bye.
Bye. Thank you.
Alors, on va se parler bientôt.
Au revoir.